Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Hello, my name is Dr. Derek Barron, and welcome to another amazing episode of the Prime Health Podcast. We interview doctors, nurses, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. We explore breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. Before we get into today's episode, I want to do a quick sponsor message of the Prime Health Podcast, and it's brought to you by Grow Solutions, your growth partner for busy health and wellness professionals. We help health and wellness professionals with some of the biggest headaches, such as new patient lead flow, AI and tech overwhelm, and ways to streamline business operations. Here's what changes happen when you work with Grow. We find new and fun ways to generate steady flow of leads. We simplify the platforms for better communication and follow up with your patients. We work together to put fun and engaging campaigns to attract new patients, new staff, and referral partners. And we also offer clear playbooks and automations that cut down the busy work to let you enjoy life away from your clinic and practice. So if you've ever said this, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we'd love to be a help with you. So drop a message below with the word grow or send me a message on LinkedIn. But the most important part today is our star of the podcast. I want to welcome you to the podcast, and I'm pleased to introduce Dr. Tiffany Mullen. Dr. Mullen is the CEO and co-founder of Vytal Health, a Milwaukee, Wisconsin-based telemedicine startup company. She is also an integrative and functional medicine physician caring for patients at Vytal Health. Years after feeling frustrated by healthcare, both as a patient and as a physician, Dr. Mullen left corporate healthcare, behind to co-found Vytal Health. Vytal Health is a membership-based telemedicine company focused on helping people solve health problems that have been overlooked or undertreated by traditional healthcare using functional medicine. The Vytal Health team of physicians, nutritionists, and health coaches treat the whole person, focusing on lifestyle, nutrition, sleep, managing stress, moving the body, in addition to medication and other interventions when necessary. They are using cutting-edge technology and advanced biomarkers to get results, transform unhealthy, disgruntled patients into thriving humans. It sounds like I need to have a further conversation. Vytal Health is available to patients across most states in the U.S., bringing affordable functional medicine care into the homes and offices of thousands of patients across the country. So, Dr. Mullen, welcome to the Prime Health Podcast.
Thank you, Dr. Derek. It's so nice to be here.
Absolutely. So I like to start this question by, I read up on your bio, has an interesting kind of a backstory, but what was that moment or that situation that caused you to join the path of healthcare?
I think it's not necessarily a moment, but rather sort of more of a series of moments. As you mentioned in my bio, I've been a patient my whole life. I was diagnosed with an autoimmune disease in childhood. When I was about a year and a half old, I was diagnosed with juvenile idiopathic arthritis, which used to be called JRA back in the day.
Right.
And so I spent a lot of time on the patient side, and then eventually decided that I wanted to become a physician and working with people and trying to make healthcare better, because I've experienced all of it, right? All of the good stuff, all the bad stuff.
Sure.
So I've been in all different types of practices, but ultimately ended up with corporate healthcare, kind of climbed the ladder there, made it up into a medical director position, and then sort of looked around and said, wait a minute, what we're doing here in healthcare and what I do in functional and integrative medicine, the business models just don't go together. We want to keep people sick and using the system in the traditional healthcare world. And on the other side, in functional and integrative medicine, we want to solve the problem at the root cause. So there was this clash of business models / values that I think was sort of happening all along. And then I think the tipping point for me was really about becoming aware of how to run a business, which is obviously not something that you do in medical school. You don't learn that. And so I had some opportunity to work in innovation for the large healthcare company that I work for, got some business chops, and then felt like, okay, I want to do my own thing. I'm ready to go. So it was kind of a series of things, I think, that led me to this point.
Okay. It's basically the round hole in the square peg, right? Like healthcare.
Very much.
It sounds like you offer both the square peg and the round hole and vice versa whenever you need to fit. And that's what integrated healthcare does.
Yeah.
So, yeah, Dr. Mullen, who makes up the team at Vytal Health?
So it's a very small but mighty team. I am the CEO and founder, and I'm also a practicing functional medicine doc on the platform. And then I have 2 full-time employees who are well-versed in wearing the myriad of hats that you have to wear in a startup company. So we are the core team, just the 3 of us. And then we have a total of 5 docs, a nutritionist, and a health coach that make up the rest of the team. And we're dispersed all over the country. So we've always been a telehealth model from the very beginning, and even before COVID. So it was this idea of being able to take functional integrative medicine and place it in places all over the country where patients normally didn't have access. The interesting thing about the business, I think this is kind of worth calling out, is that we are not a medical group. So we're not actually a practice. We are a platform. So Vytal Health's role in serving the populations that we serve is representing both the patient side, helping patients find the right physician, and then helping the physician side as well. Having doctors who don't want to run a business, who are interested in practicing telehealth, but really don't want to get in the weeds around how to run a business. So Vytal Health serves as sort of the technology, the human support, sort of all of the bells and whistles, so to speak, around running a practice, so that everyone else can just kind of do the thing of the true medicine, which is the relationship between the doctor and the patient.
Very interesting. To be honest, I've not heard of that before, which is fantastic. It's always good to be in the blue ocean.
Yes.
For sure. So if, as you say, you were family practice and now you're integrated, how do you explain to somebody that isn't familiar with integrated medicine, how do you explain that? And then how do you tell them, well, this is how we're different at ours? So you don't walk into the door and swing it open and see 10 people sitting at the desk. How are you kind of differentiating those for yourself?
Yeah, that's a great question, because I think the word integrated is used in large healthcare systems. So they talk about having integrated models, meaning we have hospitals, we have pharmacies, and we have doctors' offices and specialties and surgery centers in this integrated model. And so that's, I think, confusing to patients, because integrative, which is the other word that we use, which is sort of a newish term over the last couple decades, really refers to all of the offerings within healthcare, within medicine, that don't necessarily fit in that traditional medical model. So integrative means we incorporate other tools. We have herbals, we have nutrition, we have acupuncture, we have Reiki healing, we have chiropractic, we have massage, we have a whole repertoire of tools that we can recommend for patients. And then sort of a subset of that umbrella is functional medicine, which is a way of unpacking symptoms and problems and medical issues that have a name but don't have an easy to find cause. So sort of a classic example would be fatigue. You go into a physician's office and you say, I'm tired. The very harried family practitioner will look at you like, oh no, this is terrible. How am I going to do this? And so we're interested in sort of like, what is going on? Is it a deficiency? Is it a hormone issue? Is it burnout? Is it lifestyle? Is it a combination of these things? Is it something genetic? Is it, really, is it gut? It's really unpacking all of these things and trying to figure out root cause. So integrative and functional medicine aren't exactly the same thing, but they fit a nice continuum that sort of allows the patient to have the best of everything.
Do you find, Doc, that there are some people out there that have misconceptions, whether it's personal, that what they've read, Dr. Google, what they've been told by their primary care physician, that you don't need to do that? So are there some, small, large misconceptions that people have about doing integrated and/or functional medicine?
Yeah, I think that there's still in the traditional medical community still a lot of undereducation, I'm just going to put it that way, in terms of what integrative and functional medicine can offer. When I was working in large healthcare system and I educated other doctors about what we did, I think that they saw the opportunity to share care of patients that were particularly difficult for them, that they couldn't quite figure out what to do with, or that they sort of ran out of options. They did their basic panel of labs and said, I don't know what else to do. Right. So there's an opportunity there, I think, for doctors to partner with functional and integrative docs in particularly challenging cases. But yeah, there's a lot of misconception. And I think the growth in functional and integrative medicine is really largely driven by patients. Yes. Consumerism is huge in medicine, as you know, and the sort of, allowing everybody to have access to information, i.e. what you can get on the web, that democratization of information really has made a huge, huge difference in terms of patients understanding what their options are. And so that's really driving the movement.
Will you see some patients that come to you, your virtual office, if you wish, and then you'll co-work along with their current physician as well?
Oh, absolutely. We do that all the time. I mean, I think that's kind of the rule of the game is because we're only virtual and only telehealth, we really want our patients to have boots on the ground docs. So whether they have a family doctor or they have a gynecologist, a pediatrician, if they happen to be a child, so that they have somebody that's able to see them in person if they need to be seen in person. That collaboration is critically important, I think, to the model, which we understand. I think the best model is hybrid. It's not all telehealth. It's not all bricks and mortar. It's some combination of those two things.
Okay. And do you, like, from a treatment approach, do you see an average, we see 70% of this, like, do you see more types of conditions commonly presenting to your telehealth practice? Yeah,
I would say like healthcare, we see primarily women. Healthcare is 80% women. Women tend to be the drivers of healthcare use. So the majority of our practice is women, not that it's necessarily women's health issues, but it just happens to be women who are pushing, to try to get answers. And then we tend to see their children, their husbands, their partners, their brothers, whatever. I would say the biggest issues that we see in our platform are probably mostly related to things like fatigue, things like thyroid issues, hormone issues, gut health issues, irritable bowel syndrome, which is just everything that you can think of that doesn't have a really good solution in traditional healthcare. Those are the people that are like, what else is there? What else is available to me in my repertoire that I can say, like, okay, I need to go to a functional medicine practice and get some help.
Okay. I think every patient's overall health is important, but if you have somebody that's, burned out, stress, cortisol, somebody that is, having a life change, death in the family, divorce, are there certain overall life changes that really cause a detriment to somebody's potential health improvement?
Yes, all the things that you listed, but I think the ones that we tend to see the majority of in our practice are women who are burnt out from trying to be everything to everybody. And then the perimenopausal, menopausal transition, which I think has a gigantic impact on not just the patient, the woman, but also everybody in her orbit. And so that tends to be a very chaotic and sort of ruptured time for a lot of people. And they come in to try to work through that stuff. And I'm glad people are talking about that more. That used to be sort of a taboo topic, but it's coming around.
Yeah, it's very taboo for men to talk about it. Makes sense.
I know.
Feel uncomfortable, but I'm married. I've experienced it with my wife, my mother, my sister, my in-laws, all those. It's just too common to not want to be able to help.
Absolutely. And such a very approachable and treatable and supportable issue. Yeah.
So I take it how you started this practice, you're an innovator to begin with. So how do you see the innovation like on the horizon? Like what do you see innovation is changing as healthcare goes on year after year? Yeah,
I think the innovation thing is key because I think, again, what we tend to think about when we think about medicine and innovation is sort of the breakthrough drugs or the robotic procedures or, the use of the electronic medical record, which is something that's come about during the time that I have been in practice. But I think where innovation is going now is the connectivity thing. I love how much stuff is home-based. So we're doing sleep studies at home. We're doing, lab testing at home. We're doing, visits at home. We're doing, in certain parts of the country and in certain parts of the world, hospital care at home. And so we have this connectivity in places that didn't used to represent a traditional healthcare setting, but are now opening up the door to saying like, okay, I can actually get a visit done. I can get labs done at home. I can take a test at home. I can monitor my blood pressure and use a Bluetooth-enabled blood pressure cuff to upload all of that into the portal to see that I have continuous glucose monitors. I have, Bluetooth-enabled scales, and so on and so on. And I think where we're going is just more and more of that. So, in the next few years, we'll have home-based Pap tests done off of urine. We have patient-enabled ultrasound. We have all kinds of things that are going to really allow the streamlining and the decreased cost of having all that overhead that we see now will definitely continue to be, I think, a driver in innovation.
Yeah. I don't know if hospitals will like the fact that people are staying at home more. They make their money when they're there, and those
That's true.
They make a lot more money when they're there and they get sick. And
That's right.
the world of treatment. Yeah.
That's
Well,
true.
that's amazing. My wife's a type 1 diabetic, and as her pumps have changed over time and how they've improved, and the CGM that she wears is amazing for what it can do. And as I get older, I'm glad it's there because it can take care of her better than I can,
Yes, it's so incredible what we've been able to do with these different types of monitoring devices. It's come a long way.
Yeah. From a business demand perspective, do you feel as though there is more of a demand for your services in the last 3 years or so?
Oh, for sure. We have grown tremendously. We've been in business almost 7 years this month, and we have seen a lot of growth over the last 3 years. In the last 5 years, Google searches for the words functional medicine grew 5,000%. Just to kind of give a sense of like what people are looking for in the understanding of functional medicine. I also think telehealth, obviously on the heels of COVID, that was a huge disaster, but also in terms of people becoming more comfortable with use of telehealth, that was a huge pivot. And we're in the heart of the Midwest. And so for us, we're not exactly the first parts of the country to do technology and innovation. And so being able to have people become very comfortable very quickly with telehealth, I think has been also very huge.
That's great. So how do you think patients are finding your services? If you're in Milwaukee and I'm in Idaho, how would I come across your business?
Well, we definitely advertise. So we're in about 36 states now in the United States where we can see patients, driven completely by licensure. So during COVID, when the laws were much more relaxed, we could see patients in 50 states. And then after the emergency orders started to expire sort of in a rolling fashion, we found ourselves in a place where we could see patients in about 36 states. And so we advertise mostly in ads, Google ads, SEO, so that people, when they're looking for us and they use, search terms, they find us.
Okay. Well, that's good. As you've advanced from this, so again, you were an innovator, you were out in front of doing the telehealth prior to COVID hit. What are some of the biggest challenges that you see coming forward in your business that other people might also be experiencing?
I think primarily it is regulatory. So I think what I see a lot of folks doing who aren't necessarily business people or who aren't physicians is they sort of get out a little bit over their skis. They don't understand how regulated and sort of challenging the healthcare environment can be. So, I sort of shudder when I see the 21 or 22-year-old out of Stanford trying to do a digital health company. I'm like, that's a little bit scary.
Yeah.
It depends on what it is, obviously. But so I think it's just really having a solid understanding of sort of what you're up against in healthcare. And if you've been a practicing physician, you tend to have a sense of that HIPAA and cybersecurity and all of the sort of pitfalls that we experience in medicine. There's a whole other sort of side of regulatory stuff when you're in business, which is the financial regulatory side. But so I think that is the biggest sort of area where people need to become a little bit more educated before they necessarily hang their shingle and start practicing.
Yeah, it's a big leap of faith, and there's a lot of moving parts to having a practice, and having a virtual practice, I'm sure, is even more difficult. What does Vytal Health do to educate patients, whether they're your own or potentially those that are out there to learn about you? How do you go about educating patients?
We have, for our own patients, we have a monthly newsletter that goes out. We do podcasts as well, and a lot of educating people around topics on our website. We also, in the last year and a half or so, started something called Vytal University, which is kind of a unique offering for patients. So this is on our website, something that you can engage with on the website that basically allows a patient who's not quite sure whether they're ready for a full-on relationship with a functional medicine doctor to dip their toe in. And so they can take a course. It's a series of video lectures for the patient level, including a test kit that the patient can do on their own, and then explore the test kit results with me, essentially, or one of the other people who do the Vytal University courses. So it's a nice way for people to kind of explore a topic that they're interested in that maybe they are not quite ready to work with a doctor, but still can kind of take it far enough so that they can understand, is this something I may have or may not have? And is this something that I feel like I need to go to the next level with doctors? So getting innovative around how to bring patients into this and make it more interactive and interesting for them and personalize it for them as much as possible.
Personalization is very important. People are afraid now when it comes to healthcare because of what has happened, and they're always looking for somebody. So you're building trust with them to start with, and then advance them on. So that's great. So what advice would you give, Dr. Mullen, to potentially a family practitioner that's saying, okay, I've been in the hospital scene, I've been in the private practice scene for a while, I'm looking to maybe start out on my own, maybe doing this type of telehealth. Of course, besides working with you, what other advice would you give them?
I had a great conversation with an innovator who was in the digital health space, not a physician, when I was first considering starting the business. And we met a couple of times. And I think that was really, really helpful for me to just get a sense of sort of what it takes to raise money, what it takes to start something, what are the things I need to be thinking about, what do I need to be thinking about legally, and getting referrals sort of within my ecosystem. But I do remember that I asked him, if this were you sitting here, what would you say to me? And I remember he wrote on my notebook where I was taking my notes, he wrote, "Do it."
Oh, really?
He wrote, "Do it." So yeah. I have to say, like, I have said in so many ways, shapes, or forms since I left my job, do it. It's not easy. It's challenging, but it's so worthwhile. And I like to see more and more physicians become autonomous. We have been, I hate to use the word held captive, because obviously we do have options, but really the large healthcare system has gobbled up so many practices and really puts especially family medicine docs in a really difficult position of having to choose between the hard work of being an entrepreneur and what seems to be the harder work to being in a large health system and having to deal with that whole situation. So I would say do it. Definitely work with other people who have gone before you, who can give you advice. Go sit in on some courses, learn as much as you possibly can, and then just take that giant leap forward.
Love it. So from a business perspective, let's say hypothetically you have a problem and we're going to hand a magic wand over to you, and out of that end of that magic wand has some pixie dust. What are some things that you and your business currently struggle with that you wish that there was an answer to it?
Pixie dust. Oh my goodness. Wow. It's really interesting. Derek, I think that the biggest issue that I struggle with in the business is anytime my beautiful little ecosystem, it is my baby, so I got to call it that. Sure. And all of the wonderful things that we do to support patients and physicians, as soon as we have to sort of dip outside of that world and interface with traditional pharmacies, traditional labs, traditional healthcare, and we can't protect the patient from that experience, that's where the hardest stuff shows up. Because patients, advocating for yourself as a patient is really hard. When you're in Vytal Health, we advocate for you. When you go outside of Vytal Health, we do the best we possibly can to advocate for you. But it's a huge, huge lift on the patient side. What's a prior authorization? Where do I go with this? How much are these labs going to cost? What do I have to think about in terms of my insurance? It's such a bewildering environment. And we try to the best of our ability to help patients navigate. That's a big part of what we do. I would love to see some type of business come out of making that easier for people. I think there have been businesses that have tried to do that, various approaches to transparency and care navigation and all kinds of things. But that is, I think, the biggest challenge for when you feel like your product is really, really good, but it still has to operate in a larger sphere of sort of a stressful situation.
So can you give me an example of like what a break is in that? So if I'm a patient of yours, and is it the communication with my physician that I go and walk in boots on the ground and see? Is it a break in? Because my wife and I are just looking at one of our, EOBs that came in, and to try and explain that to somebody that's 20 or to try and explain that to somebody that's 80, that's a problem. And you, as within Vytal Health, I'm sure you take longer than the average physician with your patients, which is phenomenal. However, as you're saying, you can't take all of that time. So it's where's the loss in that? I'm not sure if that's a great question.
Yeah, no, I think I get it. So I do think it is about helping patients to the best of our ability in understanding at least the language and at least where the pitfalls are going to be. So I'll give you an example. We order blood work all the time on patients. we have within Vytal Health a very, very low cost cash option for blood work, where they can go to a national blood draw center. It's not anything that we own, and they can go there. They know exactly what it's going to cost, but they also pay for insurance. So they're saying, this is blood work, it's cholesterol and, blood count. My insurance should cover that. So we help them try to understand, do you have a deductible? Is your deductible met? Which codes cover blood work? Is it screening codes or diagnostic codes? So there's a lot of that kind of helping them understand so that we can remove, hopefully, the element of surprise. We don't always. Yeah. Things happen probably every single day where a patient's like very confident that their insurance is going to cover something, and they go into the lab and they have $1,200 worth of lab work done and they have a $3,000 deductible. And it's awful for them. Yeah. Whereas we could have probably done those labs for like $300. So it's a gamble, and that's what makes it really hard. We feel bad when that happens. We try to the best of our ability to pad that, make it easier, help patients make that decision. But ultimately, that's kind of bait and switch stuff that patients go through all the time.
Unfortunately, very true. It's you do your best, but we pay for insurance. We want to use it to its full extent.
Right. That's right.
And sometimes it makes it harder to use. And when you have somebody that comes in with fatigue and they're going to have their thyroid exam done from a blood statement, you'd measure 3 different levels. The typical is going to pull 1 level at the hospital.
That's right.
So now you're missing those 2. Now they have to do it again.
That's
and
right.
They're questioning you versus questioning the hospital.
Yes, that's right.
That's a hard thing.
It is hard. But we help them a lot. And I think patients are very, very appreciative of how much time and energy that we put in to try to make it as best we possibly can for them.
Okay. This is hard because you see so many different types of patients in your office, but what metrics do you use to show successful outcomes for your patients?
So there's 2 that we follow very, very routinely. On the patient side, we obviously have our own internal KPIs related to the business, key performance indicators. But on the patient side, we track satisfaction. So we have patients who every single time they see a doctor, we have them fill out just a little 5-question, 5 stars, give us your feedback on how this all went. So we track those. And then we also track what's called an MSQ, which is a multi-system questionnaire, which really speaks to outcomes. Functional medicine, as you know, is a very complex set of problems. It's never just filing into one particular category. It files across many, many categories, many different organ systems. And so the subjective experience of the patient in terms of their symptom load is what that MSQ measures. And so we measure MSQs at the beginning of care. We measure them at 6 months. We measure them at the year. So we can see that we're tracking progress, and it really helps patients to see, oh yeah, look at that. I only have half as many symptoms as I did before, so that's really critically important. So the patient experience side, I think, is the most important piece that we track.
Okay. From like being a back pain guy myself as a chiro, and you can give them the oswestry, they feel better. They don't know if you help them or not, but you can show them that they've improved, because we forget how we were. It's very easy in life to see that. So it's great that you have kinds of options that are out there. So from a patient impact and or outcome perspective, can you share a story of a patient that's had a great result? And it might be yours, but a patient that's had a great result working with you.
Yeah, so many stories. I have had so many incredible breakthroughs with my other docs who are really good. We have one particular physician in our practice who is excellent at fertility. And I can't tell you, I've lost track at this point, how many unknown fertility problem patients, everyone's like shrugging their shoulders like, I don't know why this person can't get pregnant. Yeah. And she gets them pregnant. I mean, I can't even tell you how many times that's happened. And that's very, very joyous for us.
Virtually, it's all virtual. It's not much of it.
Right.
That's amazing.
No interventions. No, this is not about, any type of intervention. This is about fixing underlying root cause issues that are missed, dealing with those, and then voila, it's pretty incredible. I had a patient recently who had just a myriad issues with mental health issues and gut health. And we tested some gut health markers and a neurotransmitter profile, and we're able to really get a solid breakthrough on some very long-standing depression issues, with monitoring some issues that were present in the gut, and then really understanding what the drivers were in that neurotransmitter profile. And that was mind-blowing for him. He had not been able to move the needle in decades, and we were able to make that better. And it came down to not needing medications in the end. as well, which is amazing.
Cost savings and body savings, eliminating some of the medications there. That's
right.
Great. Where would you like to see Vytal Health in the next 5 years?
Oh my gosh. Well, obviously love to grow, continue to grow as we have been over the last 7 years. I'd love to be able to be back in all 50 states. And that's just a matter of trying to figure out where sort of strategically we need to show up. So that's a piece of it. And I think also just continuing to have really, really good outcomes, driving our revenue forward. Obviously, I have revenue goals that I'm trying to hit this year, 5 years, 10 years. So hitting those revenue goals and then being able to grow the team. So we are, like I said earlier, we're a small but mighty team. I would love to be able to add more talent to the team as we move forward, hiring some in-house people that I currently do with consultants so that we can have a more cohesive, completely dedicated to the company group of people as part of our team. So, just a couple small goals.
So from being an innovator, I want you to tell us how you're a differentiator. What I mean by that is what makes you and Vytal Health, your company, different than any other company that's out there?
I think Vytal Health is the place that you go to as a patient or a physician where you will be recognized as an individual. So we are all about the heart. And by that, I don't mean cardiology. I mean, we're all about knowing people very, very well. The biggest driver of our business is the people. So we are a telehealth company, yes. We are technology, yes. We are a platform. All of those things are true. But the human element of our practice, of our group, of our business is the most important thing and always is the emphasis. So we'll never be a company that's going to, throw people under the rug to make things more streamlined in a negative way. I love streamlining and I love efficiency, but not at the expense of the human element. So having the technology and the human piece, I think, is what makes it really, really special.
Yeah. It's hard to have that when you're sitting knee to knee and putting your hand on somebody's on their knee and having to build that trust in person. I'm sure it's even harder when you're doing that virtually, but time after time after time of having those meetings, you build that trust. And I think the trust can be improved, especially because the amount of time you get to spend with them.
I think you're absolutely right.
Yeah.
Yep. That's exactly what it is. I think it's just, we know our patients really, really, really well because we spend hours and hours and hours with them. And they feel heard and seen. And that's the most important thing for me.
Love it. So if you want more people to hear and see you, how can they get a hold of your business and learn more about your business?
Yeah, go to our website. It's a great place to start, www.vytal, with a Y, V-Y-T-A-L, health.com. We are on Instagram and Facebook at Your Vytal Health. And those are probably the best places to find out about us. We have a little podcast that's on Spotify that you can listen to. You can search Vytal Health, you'll find it. We have a YouTube channel as well, Vytal Health, you can find it. So on LinkedIn, we're in all the places. Okay. So any place you put in Vytal Health, V-Y-T-A-L Health, you'll find us.
Okay, I'll make sure to add all of those links inside the show notes as well for people to reach out. So Dr. Mullen, thank you very much for taking some time away in that beautiful state of Wisconsin to have the conversation with me. I really appreciate the experience you have. It's a very unique perspective to, as you said, being a patient, being frustrated in the patient realm that you're at and trying to offer something for yourself and eventually growing that to offer people not only in your area, but virtually in all other places. So for our listeners, if you found today's conversation valuable, please make sure you're subscribed to our Prime Health podcast on your favorite platforms or subscribe to us on YouTube as well. And if you found that this was helpful for yourself or anybody that you know, please do share it because we would love to get Dr. Mullen's story out and Vytal Health's story out there so more people can take advantage of that when they're sitting at home and they're maybe in a rural area and they can't get into the hospital as much as they need to. Vytal Health could be a very good option for them. There's many cutting edge treatments that are there that can be learned about over the phone or over the computer like this. So until next time, remember that true wellness is a journey and we're all on together. Whether you're taking charge of your own health or guiding others in theirs, every step forward matters. Take care of yourselves, and I'll see you next time.
Thank you.